Patrick Kennedy.
Now I'm your representative, so to speak, down here in New Jersey. I just follow you. Follow you, Aaron. I want to thank you, Aaron, for your great leadership. You are showing how someone in recovery can take their recovery and help allow an opportunity for others to recover, not simply because you are working your own program of recovery, but you're also a good citizen. And many of us who are in 12-step groups often don't make the connection between following our own recovery and making sure we protect it, but also being citizens. And that means, as the senator pointed out so eloquently, showing up and giving a voice to these issues. Because as the senator pointed out, the main problem we all have in the discrimination that exists against people trying to practice medicine in this field, or in the public funding for this field, is that there is no advocacy. Now, the advocacy for the whole state of New Jersey is probably in this room, right? So you all, I'm obviously speaking to the choir because you're all already active. But for those of you who are just learning about this, I'd encourage you to follow Aaron's admonition and sign up. When you leave here, sign up to become an advocate, because that does not violate any of the principles of the program we all know in 12-step recovery, because that's your other program. This is the program of getting results with your tax dollars. So let me thank Carol for her great overview. And let me just point out what this is about. Senator Singer, I don't know whether to out him or not, but he's a Republican. All right, so I just want you to know, so you give a little background, these diseases, you know, they don't affect Democrat households or Republican households. They affect all American households. And it's worth my noting that my co-sponsor on mental health parity is a Republican by the name of Jim Ramstad. And my father's Republican co-sponsor is Senator Pete Domenici, and it was President George W. Bush who signed the parity law into effect, okay? So, you know, I want everybody to know that. Now, let me just quickly encapsulate what Carol said. If you had cancer, you wouldn't expect to have to wait till you had stage 4 cancer before you got treatment. That's how today we reimburse for mental health issues. We wait until you're at death's door before we say you're worthy of treatment. If you had diabetes, do we wait until we have to amputate your legs or you go blind? Hopefully we don't. In fact, our healthcare system reimburses for all kinds of preventive care. You know, you get your insulin, you get your access to primary care doc, you get your test strips, you get all of that covered. Now, I have 2 chronic illnesses. I have asthma, and I get my inhalers. I get my primary care doctor, takes care of it. You know why? Because they don't like me showing up with asthma attacks in the emergency room. And I've been in the emergency room plenty of times for my asthma. So they give me medications to keep my asthma stabilized. They give me not only fast-acting inhalers, they give me long-acting inhalers. And and they don't question if I do have an asthma attack that I need care, and I never have to worry about my insurance reimbursing for it. Now, my other chronic illness is that I am in recovery for addiction, and that chronic addiction, that chronic alcoholism that I have is not treated the same way. And so I want you to understand the difference. Now, when you have an addiction, if you go to the hospital, they think you're cured. So if you do manage to get treatment, you probably run up against your treatment limits, and then you leave and they say, it's your fault if you get sick again. Now, do they say that to the diabetic who also drinks or eats chocolate cake and has a diabetic shock? Do you think they send them outside the ER and say, oh, wait, sorry, you're a moral failure. Get out of here. No, they don't do that. So my point is that, as big a challenge as we have outside, we also have to change our own perceptions and hidden attitudes towards these illnesses. Because when you're in active addiction, you're not a very happy person, and you're not a very happy person to take care of. All right? So we are inviting of a lot of these stigmas and stereotypes, but we need to address them straight on. And I want to thank all of those who are going to be testifying tonight for helping to break the cycle of silence. Because the biggest killer in this illness is the isolation and the silence that accompanies these physical illnesses. And they are brain illnesses. But we don't treat them as physical illnesses. We don't treat them as medical issues. We treat them as moral issues and as character issues, not chemistry issues. So that is essentially what we're up against. I want to thank you all in advance for your testimony. We're going to listen to our panels and offer some insight. But why are we all here? We're all here so we can change this situation that the Senator and Carol outlined for you. So that for your kids and your family members in the future, if they need health care, we have a checkup from the neck up. Not just blood pressure being checked and whether you're high risk for cholesterol. Right? Maybe it'd be good for us to check whether you're high risk for addiction. Maybe it'd be good for us to check whether you're high risk for depression or psychosis. Maybe it'd be a good thing to do those things. And right now in our country, can you believe it? In this day and age, we don't check the most important organ in our body. I mean, I'm not making this up. It's pretty shocking when you think about it. The most important organ in our body, and our whole healthcare system ignores it. So we have a lot of work to do. And I'm so happy you're here tonight to help us get underway here in New Jersey. Thank you all for coming.